Shawn Callahan is a 45-year-old man that has had Crohn's disease since he was 19 years old. He was also recently diagnosed with severe colitis and mild dehydration. His other symptoms include his diarrhea of up to 12 times a day, nausea, anorexia, an urgent need to move his bowels, abdominal cramps and pain, and then the sensation of an incomplete evacuation. His stool was also noted to contain blood and mucus, and he noted that he has pain 30 to 60 minutes after eating a meal, which is usually relieved after defecation. And due to this severe inflammation that we're seeing in his endoscopy, he's going to be receiving a loop ileostomy procedure to create a temporary stoma in his abdominal wall, and so that waste can exit the small intestine. And then following the procedure, we're going to reevaluate at regular interviews to see if any inflammation goes down or if the stoma should be made permanent. So regarding his family history, he noted that his family has a history of nervous stomachs, but no one has been diagnosed with Crohn's disease in the past. He's also maxed out on the amount of steroid treatment and is unresponsive to any aggressive steroids that could be given to him. He has a lot of diarrhea in a day, and this could have caused his dehydration. His charts also show he's not getting enough potassium. He has blood, urea, nitrogen levels that are very much elevated. And then his blood glucose levels are high as well, which could be due to dehydration and his excessive steroid usage. So we can conclude that weight bias was present in his case. He's only has a BMI of 25.1, which is noted as slightly overweight, just above the healthy range of 25. But he does struggle with diarrhea up to 12 times a day, constant pain and inflammation. So this is another case where we should again be emphasizing health over just weight. And so if he came in the past, doctors or nurses may have seen that he's in a healthy weight or just slightly overweight, and they wouldn't likely conclude that the patient struggles with anorexia. And so this may have fallen under the cracks. Also, his excessive steroid usage could have weakened his gut lining and led to his colitis. And so to address the weight bias, we're going to need to educate our doctors and nurses on anorexia and how it can occur in people who are in normal or overweight positions, and that it can affect men as well. And so from a motivational interviewing perspective, I'm assuming he's going to come in and we're going to more want to emphasize feeling, so how he can experience less pain and inflammation over just how he looks. And that we have options to incorporate more foods. I'm assuming since this stoma is new for him, there's a lot of foods that are going to affect him differently, and so that might be something he's concerned about. So we can assure him that there are many options for foods to incorporate, and just that we're going to limit certain foods from now on because they may lead to more gas, bloating, and odors. But then following a couple weeks after his surgery, we can start integrating these foods back to see how his body reacts to them. And if they react okay, then we can integrate these more permanently into his diet. And we're going to make sure he's obtaining enough liquids to just make himself feel better overall, making sure his sodium and potassium levels are higher, and really just emphasizing how he wants to feel and describing how he used to feel before having Crohn's, and if we can get him back to that using dietary habits, then this is definitely something that could help him feel better, less lethargic, have more energy overall. Thank you.